Welcome back to 12 News at 1 o'clock. About 1 million Arizonans have had a direct experience with suicide, according to the State Department of Health Services. They or someone they know has faced suicidal thoughts, attempted or died by suicide. So joining me this afternoon on this important topic, Dr. Adia Taylor with Optum Arizona. Welcome.
Thank you.
I know this is a heavy topic, so let's start with the startling rate and how we're seeing this impact so many more younger kids. Why are we seeing it? Why are we seeing an uptick of that while I knock everything over? We'll get to these in a moment.
Well, there's a lot of issues going on with isolation, stress at home, stress with financial distress, trying to perform, and the anxiety of trying to live life as a teenager nowadays is really causing a lot of angst and teenagers.
And sometimes we talk about social media is exactly not that. You're not being social at all, and you start to feel that isolation. So what can parents and friends do to start approaching that conversation if they're worried that their loved one is maybe experiencing isolation to a point of thinking about suicide?
It's important to make sure you have open and honest conversations with the patients, with the teens and the students, and making sure they feel comfortable talking with you. Make sure that you're involved in their school, volunteering at school, you know what they're doing, so keep an eye on them, making sure that they feel comfortable with you and you're spending time with them so that they feel like there's a connection with you and that you're a good resource for them.
And I know that, leaders and people we look up to in our life, sometimes it's hard to start that conversation, and that is exactly why you brought all of these conversation starter cards, and you had a couple specific ones. So if you don't mind sharing with our viewers what stood out to you.
So the ones that stood out to me were the question is, which emoji describes your mood today? That really helps open up how you're feeling, why you're feeling that way, and help them feel like they can talk with you and that you're interested in what's going on with their day.
It's a very modern day approach to just simply ask something that simple. Like if it's a frowny face, why is it? What's going on? Okay, and then what about another one you got? I think these are great little tips.
So if you're stranded on an island, who would you text first and why? So that really helps you find out who they feel safe with, who's their support group, and so you can get to know them better. And then if you know it's just a person you don't even know, get to know that person so you know what's going on with that person's life and how the relationship is.
Before we get to a couple more of those, obviously we need to talk a little bit about the risk factors and what are some of those and things that you see in your line of work?
So for teenagers, it's stress, financial distress, low self-esteem, and then also just anxiety and pressure to succeed.
And a couple of the other things I know you guys have shared in our earlier exchanges via email, the bullying and any kind of depression that they might be experiencing. So let's go back to the cards, because really there's plenty of resources out there. But if you're around the dinner table, these are simple questions you can ask over a light meal or something.
Right.
So what's the next one you've got?
So the next one is, when was the last time you felt really happy? So they really can gauge on how often they're feeling happy, how often they're feeling sad, what makes them happy, what's their passion in life. So you can connect with them, and maybe it's a passion that you have a passion for, and you can really strengthen that relationship by having that commonality.
Absolutely. And then just lastly, again, for our viewers, resources out there that are available, what would you suggest outside of the simple, call 988, sure, but what other resources do you recommend to patients?
So having contacting the school has mental health access, or you can call, if it's really an emergency, call 911 or take them to the ER so they can get that urgent care. And that's very important.
Dr. Taylor, thank you. We look forward to having you on again and sharing all the resources available and the question cards that are fantastic. Crystal, we know sometimes the doom and gloomy days that